Here's something that might shock you. Did you know that over 90% of healthy adults over 75 who get a full body scan will be told they have something abnormal? And here's the real kicker. In the vast majority of cases, that something is absolutely harmless and would never have caused them a single problem. But what happens next? Anxiety, more tests, biopsies, sometimes even surgeries, all for conditions that would never have affected their health. I'm Dr. Robert Harrison, and in my years of practicing medicine, I've seen this scenario play out far too many times. Today, I'm going to share with you 5 common medical screenings that after age 70 often do more harm than good. This isn't about avoiding healthcare, it's about being smart with your healthcare. So, if you're over 70 or if someone you love is, stay with me. What I'm about to share could save you from unnecessary procedures, serious complications, and a whole lot of worry. Before we dive in, I want to be crystal clear about something. I'm not suggesting you avoid all medical care or that these tests are never appropriate. What I am saying is that as we age, the calculation changes. What helps at 50 might harm at 80. Medical screening is about balancing benefit against risk, and that balance shifts as we get older. Every test I'm going to mention today has its place in medicine. I've ordered these tests myself when they were the right call. But ordering them routinely, automatically, just because you've hit a certain age, that's where we run into trouble. Let's start with number 1, whole body scans. You've probably seen advertisements for these. Get a complete picture of your health. Find problems before they start. Executive health centers charge thousands of dollars for these comprehensive scans, promising peace of mind. They sound fantastic, right? Who wouldn't want to catch everything early? The problem is, these scans are incredibly good at finding things, and in medicine, finding things isn't always helpful. Here's what the research tells us. Studies show that up to 40% of asymptomatic adults who undergo whole-body MRI scans will have some kind of finding that requires follow-up. Many of these are what we call incidental, things discovered by accident that would never have caused any problems. A small cyst in the kidney, a tiny nodule in the lung, a benign growth in the liver. These are extremely common as we age. They're like the wrinkles and gray hairs of our internal organs, completely normal parts of aging. But once we find them, we can't unfind them. Suddenly, you're labeled as having an abnormality. Your doctor feels obligated to follow up. That might mean more scans in a few months. It might mean a biopsy, which carries its own risks like bleeding or infection. In some cases, it leads to surgery or other treatments for conditions that literally would never have bothered you. This cascade of interventions starts with one scan that was never medically necessary in the first place. And if that scan is a CT scan rather than an MRI, there's another concern: radiation exposure. A single full-body CT scan can deliver radiation equivalent to hundreds of chest X-rays. While the cancer risk from one scan is small, it's not zero. Why expose yourself to that risk without a clear medical benefit? So, what should you do instead? The answer is a comprehensive geriatric assessment. This isn't a quick once-over. It's a thorough evaluation focused on what actually matters for health and quality of life at your age. It includes checking your functional status. How's your balance, your grip strength, how fast you walk? These simple measurements predict your health much better than any scan. It includes reviewing all your medications. Older adults often take 10 or more different pills, and frequently the side effects of medications are mistaken for new medical problems. It includes lifestyle factors, diet, sleep, exercise, social connections. These are the real foundations of health. A comprehensive assessment gives you actionable information. It tells you what you can do to stay healthy and independent. A whole body scan just generates anxiety and sets off a cascade of more testing. Number 2 on our list, brain MRI for mild memory lapses. This is extremely common. Someone over 70 forgets where they put their keys or can't recall an actor's name. Their family gets worried and insists on a brain scan to rule out Alzheimer's disease. The intention is good, but the result is often problematic. Research shows us that 94% of people over 75 who get a brain MRI will have abnormal findings. Think about that, 94%. These findings might include things like mild brain atrophy, which simply means your brain has gotten slightly smaller with age. That's completely normal. Or white matter lesions, tiny spots on the brain that look concerning but are found in over half of elderly individuals and usually mean nothing more than years of high blood pressure that wasn't perfectly controlled. The problem is, when you're 78 and your scan report mentions cerebral atrophy and white matter disease, it sounds terrifying. Even though to a knowledgeable physician, that report basically says this brain belongs to a 78-year-old person. To you and your family, it sounds like a diagnosis of dementia. That fear can change everything. People start doubting themselves. They withdraw from activities. They lose confidence in their own minds, all because of findings on a scan that have nothing to do with their actual cognitive function. And here's the crucial part. These imaging findings don't change treatment for mild memory problems. There's no medication that reverses normal age-related brain changes. So, the scan doesn't help you, it just worries you. The better approach, simple cognitive testing right in the doctor's office. Tests like the Mini Mental State Examination or the Montreal Cognitive Assessment take about 10 minutes. They actually measure how your brain is functioning, not what it looks like on a scan. If the test is normal, you and your family can be reassured. If it shows problems, then we start looking for reversible causes, and there are many reversible causes of memory problems. Vitamin B12 deficiency is incredibly common and easy to fix. Thyroid problems can cause brain fog. Depression in older adults often presents as memory complaints. Sleep apnea can rob your brain of oxygen at night and impair memory. Many medications, especially sleeping pills and anxiety medications, can cloud thinking. We should check all of these before we even think about ordering a brain scan. If cognitive testing shows progressive decline over time and we've ruled out all reversible causes, then imaging might make sense as part of a complete evaluation. But for simple forgetfulness, a brain scan is not the answer. Number 3, routine stress tests for the heart. This one surprises people. Isn't it good to know how your heart is doing? The problem is that stress tests in asymptomatic older adults have a very high rate of false positives. That means the test says there's a problem when there really isn't one. Why does this happen? As we age, changes occur in the heart and blood vessels that can affect the stress test results, without meaning there's a dangerous blockage. Things like high blood pressure over many years, thickening of the heart muscle, or electrical changes in the heart can all cause abnormal stress test results, even when the coronary arteries are fine. So, what happens when you have a false positive stress test? You're sent for more testing. Often that means a cardiac catheterization where a tube is threaded through your arteries to your heart. This is an invasive procedure with real risks. Bleeding, infection, damage to arteries, kidney problems from the contrast dye, and in many cases, the catheterization shows that the arteries are fine, the stress test was wrong, but you've been through an unnecessary procedure with unnecessary risk. Even worse, sometimes the stress test itself can trigger problems. While rare, stress tests can cause dangerous heart rhythms or even heart attacks in some people. For someone with symptoms like chest pain with exertion, a stress test makes perfect sense. We need to know what's going on. But for someone with no symptoms who can climb stairs and walk briskly without any problems, you're already passing a stress test every day. Your daily activities are telling us your heart is working fine. If you want to know your cardiac risk without the problems of a stress test, there's a better option. Coronary artery calcium scoring. This is a quick, low-radiation CT scan that measures calcified plaque in your arteries. A score of 0 means very low risk of heart attack in the coming years. A high score tells you that you need to be aggressive about prevention with medication and lifestyle changes. It's informative without the cascade of interventions that can follow a false positive stress test. Number 4 is colonoscopy after age 75 to 80. Now, I need to be very clear here. Colonoscopy is an excellent screening tool. I strongly recommend it starting around age 45. It saves lives by finding and removing precancerous polyps. My concern is continuing routine colonoscopy into advanced age when previous screenings have been normal and you have no symptoms. Here's why. The benefit of colonoscopy is preventing colon cancer that would develop 5 to 10 years down the road. But if your life expectancy is less than 10 years, either due to age or other health conditions, you're unlikely to benefit from screening. Meanwhile, the risks of colonoscopy increase with age. The bowel preparation alone can be dangerous for older adults. It involves drinking large amounts of laxative that can cause severe dehydration and electrolyte imbalances. For someone with kidney disease or heart failure, this can trigger serious complications. The sedation used during the procedure carries higher risks in older adults, including confusion, breathing problems, and dangerous drops in blood pressure. Then there's the risk of perforation, a tear in the colon wall. Overall, perforation happens in about 4 per 10,000 colonoscopies, but in people over 75, particularly those over 80, the risk is higher. The colon wall gets thinner with age, making tears more likely. A perforation is a surgical emergency. It often requires major surgery, sometimes resulting in a colostomy bag. For an 80-year-old, this can mean the end of independent living. The major medical guidelines reflect this changing balance of risk and benefit. The U.S. Preventive Services Task Force recommends that screening decisions between ages 76 and 85 be made on an individual basis considering overall health and prior screening history. They recommend against routine screening after age 85. This doesn't mean we ignore the colon after 75. It means we shift from screening to surveillance. You need to know the warning signs and report them immediately. Persistent change in bowel habits, blood in the stool, unexplained weight loss, new anemia, persistent abdominal pain. If any of these occur, age doesn't matter. Investigation is warranted. Prevention continues to matter too. A high-fiber diet is your best friend for colon health. Fruits, vegetables, whole grains, beans, and lentils feed the beneficial bacteria in your gut that produce anti-cancer compounds. This dietary approach is much safer than repeated colonoscopies and benefits your entire body, not just your colon. Our fifth and final screening is PSA testing for prostate cancer in men over 70. This one has been controversial for years, and for good reason. The prostate-specific antigen, or PSA test, has created an epidemic of overdiagnosis and overt treatment. Here's what makes prostate cancer different from many other cancers. It grows very slowly in most men, especially older men. Autopsy studies show that up to 80% of men in their 80s have prostate cancer at autopsy, but most died with it, not from it. It was just sitting there, never causing any problems. The issue is that the PSA test can't distinguish between aggressive cancers that need treatment and slow-growing cancers that will never cause harm. So, we find all these cancers, and once you tell someone they have cancer, they want it treated. But treatment for prostate cancer is no small matter. Surgery can cause permanent incontinence and erectile dysfunction. Radiation therapy causes similar problems in many men. These side effects dramatically impact quality of life. The U.S. Preventive Services Task Force looked at all the evidence and concluded that for men 70 and older, the potential harms of PSA screening outweigh the benefits. The chance of finding a cancer that would actually kill you is very small. The chance of overdiagnosis and harmful treatment is substantial. They estimate that overdiagnosis rates are more than 15 times higher in men over 85 compared to men in their 50s. What about family history or other risk factors? Those absolutely matter, and they might shift the balance towards screening even after 70, but it should be a discussion, not an automatic test. An informed conversation between you and your doctor about the real numbers, the real risks, and what matters most to you. For men who are diagnosed with very low-grade prostate cancer, active surveillance is often the best choice. This means monitoring the cancer without treating it unless it shows signs of becoming more aggressive. Regular PSA tests and periodic biopsies keep an eye on things, but you avoid the life-altering side effects of treatment for a cancer that's very unlikely to harm you. So, there you have them. 5 screenings that after age 70 often create more problems than they solve. Whole body scans that find harmless abnormalities and launch cascades of unnecessary testing. Brain MRIs for mild memory, concerns that generate anxiety without providing useful information. routine cardiac stress tests that have high false positive rates in older adults, colonoscopies after 75 or 80 when prior screenings were normal, and PSA testing in men over 70 that leads to overdiagnosis and overt treatment of slow-growing cancers. What's the thread connecting all of these? They're all examples of looking for problems in people who don't have symptoms. And as we get older, that kind of searching becomes less and less likely to help us and more likely to harm us. I want to emphasize again, this isn't about avoiding medical care. It's about smart medical care. It's about focusing on what actually improves health and quality of life. A comprehensive geriatric assessment beats a whole body scan every time. Brief cognitive testing beats a brain MRI for mild forgetfulness. Knowing the warning signs and maintaining a healthy lifestyle beats routine colonoscopies in very elderly people. And honest conversations about goals and values beat automatic PSA testing. The goal of healthcare after 70 shouldn't just be finding every possible problem. It should be maintaining function, independence, and quality of life. Sometimes the most powerful thing a doctor can do is not order a test, to sit with a patient and really listen, to focus on what matters most to that individual, to help them stay active, connected, and engaged with life. If there's one message I want you to take away from this, it's this: you have the right to ask questions. When a doctor recommends a test, you can ask why. What will we do differently based on the results? What are the risks? What happens if I don't do this test? These are not confrontational questions. They're the questions of an informed patient who's taking charge of their health. Medical care should be a partnership. You know your body, your values, and what matters most to you. Your doctor knows medicine. Together, you make decisions that make sense for you as an individual, not as a number on a guideline. So, the next time someone suggests one of these tests, pause, think, ask questions, make an informed decision, because the goal isn't just to live longer, it's to live well with dignity, independence, and joy. And sometimes the best way to protect that is to say no to a test you don't need. Thank you for watching. If you found this information valuable, please share it with others who might benefit. Subscribe to the channel for more evidence-based advice on staying healthy as we age, and please leave a comment below. Have you ever felt pressured into a medical test you weren't sure about? How did you handle it? I'd love to hear your experiences. Until next time, stay well and remember, smart healthcare means knowing when to say yes and when to say no.